Good afternoon. Just going to highlight some of the main points of the SAOP note assignment. So I did mine on a 30-year-old female patient who was presenting with essentially the diagnosis was generalized anxiety disorder. She did seem to have a bit of mild depression, which just could have been kind of tagging along with the anxiety symptoms and how they were affecting her life. Um, the patient is 30 years old and she's just having constant worry. She can fall asleep, but is having trouble staying asleep. So she found herself to be exhausted, fatigued, and it started affecting her life. So she's a student, she is in school, and she also works. She's in a heterosexual relationship with her boyfriend, no kids. She lives on her own. And she has kind of started to seclude herself. She's not interested in activities as much anymore. Fatigue, difficulty concentrating, just doesn't feel herself, feels tense and constantly worried about things that are beyond her control, such as her aging parents and her health, and just various random things that are causing her to she's just laying there thinking about them over and over again. So, with this particular patient, she was at risk for substance abuse because she was actually drinking in the evening about 2 to 3 beverages, alcoholic beverages, whether it be wine or a mixed drink. She said just kind of whatever she has in the house. She'll drink a few beverages at night to kind of calm her nerves. So it'll calm her mind from being anxious and thinking about all of those things, and she can fall asleep. But then once she wakes up in the middle of the night, she's just back thinking about everything again. She just had a history of hypertension. With this patient, I was a little concerned because she does have a family history of psychiatric disorder. So her mom actually has depression and insomnia. So some things we had talked about earlier in this semester, the biophysiological health, genetics are tagged along with it. She didn't have any economic factors. She had no financial burden. She worked. She had her own place. So there was not any economic factors like, access to health care or health insurance that were um, causing anything additional with the biophysiological health, but more so the genetic background is what concerned me. So if she grew up in a household, watching her mother depressed and not sleeping, you can pick up sometimes just those personality traits, behavioral traits just from seeing it and being around it. To you, that's the normal response to sadness or stress or what have you. So that was a little concerning with this patient. She had had no prior episode, so I don't know necessarily what triggered this anxiety. So, negative review of systems and health assessment, aside from the psychiatric portion, which she expressed, the concern with her drinking. She didn't want to get dependent on alcohol. So that was a really good point for our motivational interviewing aspect. So with motivational interviewing, we're doing more listening. Instead of me directing her what to do, I'm engaging her in what she thinks may be beneficial to her and applauding her efforts for seeking care, for coming in, for being concerned with her health and not wanting to excessively drink. So that was a really good starting point for our motivational interviewing. And this patient actually remembered that she used to like to do yoga. She hadn't done it a while, she hadn't thought about it. So we just started talking about different things that maybe could relax her other than drinking. And she remembered that she did yoga and she liked it and it was really beneficial to her in the past. It had been a while since she'd done it. So she agreed that she would like to start doing yoga again to replace the drinking. So instead of having a drink, she was going to try to do the yoga. So that was a great point for the motivational interviewing. And with the NIDA guidelines, as we know, no one treatment works for all patients. So with this patient, that's something that she likes to do and something that relaxes her. So we're going to implement that in her treatment plan, as well as avoiding caffeine and stimulants. And because she was having, we did the PHQ-9 scale, and she's just having a little bit of mild depression, the insomnia and not feeling like engaging in activities, which I think is secondary to the anxiety, just because of the lack of sleep and not concentrating well and everything. So the first line treatment is SSRI. So this SSRI will actually help with the depression and the anxiety. So it's very beneficial for this patient to try the first line therapy of SSRI. And we did the sad person scale to make sure she wasn't risk for depression, which she wasn't. We did the cage questionnaire, and she scored 0 on that. So we're not worried about the substance use getting out of hand at this point, but it is something we will follow back up on. Since she agreed to do yoga instead, we'll see how that's going. Um, she does feel like she needs to cut back just out of not wanting to get dependent on the alcohol. So we did several different scales with this patient, the Hamilton anxiety scale, and she is pretty anxious. I think the most worrisome thing to her is the lack of sleep, and then that causes the fatigue and the inability to concentrate and not wanting to be involved in extracurricular activities. She's not doing as much with her family or her boyfriend and things like that. So we're hoping that once she starts getting some good sleep, that things will turn around for her. Um, Other than that, we're just going to have this patient try to get some exercise, which the yoga will tie into that, educating her on avoiding stimulants and caffeine and energy drinks and engaging in peaceful activities. So sometimes getting out during the day and getting the natural sunlight and also participating in exercise activities can greatly help to reduce anxiety. So with this patient, we're also going to do an EKG, thyroid studies, complete blood count, urinalysis, EKG, just see if there's anything abnormal with her thyroid. We're always going to want to rule that out with anxiety symptoms and with her cardiac function and everything. So we'll follow up with this patient in a week, and we'll go over her lab values. We'll see how the treatment's going since we're starting her on the escitalopram, which is the SSRI, only at a 5 milligram dose. We can easily titrate that up if we need to, and see how that works for the patient. So we're going to follow along closely after this 7 days. We're going to want to follow up within 30 days with this patient, and also offering her some cognitive behavioral therapy. So we're going to refer her to a psychiatrist so she can get some counseling started and be able to talk to someone about some of her problems, and hoping for a good outlook with this patient.